Hi, this is Seth, and welcome to Breaking Fat, Part 6. It's surgery day, and right now this is pre-op, so they have me all situated. I have my IV in place, most of my drugs, going to get a few more. Right now I'm probably less than half an hour away from going into surgery.
Yeah. Seahawk hat. I lost my Seahawk hat.
Oh.
It disappeared. It was awful. It was just awful.
Oh. So do you have your hat in your pocket, or do I need to?
No, I was looking at his hat.
Okay.
I have a bike hat.
I don't get a hat.
Yeah, you get a hat. You get a hat.
He gets one.
You have high
but he
blood
gets one
pressure
that
and
looks
like
like a
that?
shower cap.
No heart problems at all.
Nope, I know.
I know.
I know. Disappointed.
Yeah.
Well, there you go.
Yeah.
Did
Did you guys get my orders? I put them in from. Okay.
They gave a shot and of
Ovanox and a little bit of.
And she has it all.
and
She has it all.
Amlodipine or
She
whatever.
has it all.
Well, you got anything you want to say for the camera while you're still silly?
I got my joke out to the anesthesiologist.
Yeah.
I was really happy. That was the last thing I said.
Oh, it's awesome.
So before he put me under, I told him I had a joke for him. I said, "How do you keep an anesthesiologist in suspense?" And then I just like, that's right. Yeah, where is Perry? So I'm post-surgery, and I feel very excited to have it done and in the past. And that said, I'm still kind of always processing the thought of, did I really just do that? Like, so the surgery was yesterday, and I think we were going to try to do some post-surgery video on the same day. I think Beth got some, but I don't remember anything. And I would, after coming out of the anesthesia, I would be awake for a few seconds. I think I remember seeing my parents briefly, and then Beth, Maddie, and Clark just for a second, but then I'd just fall right back asleep. So, if I would definitely say that if you have the options to stay overnight, that you should use it. Because going home same day would have been pretty rough on my family, since they would probably had to carry me up the stairs. I don't see that happening. I did have a lot of fun when the anesthesiologist came in the room, and I got to use some of my jokes that I dreamed about before the surgery. One, he was talking about a conference that he just got to go through with other anesthesiologists. And I told him, yeah, I heard that there was some world-renowned anesthesiologist who spoke at that conference. And he went, oh yeah? I said, yeah, I heard he put an entire room to sleep at once. And they went, yeah. Pain-wise, I'm pretty sore in my stomach. I guess that's to be expected. But I'm staying on all the pain meds exactly when they say to take them, so it probably doesn't get higher than about a 4 on a scale of 1 to 10. So I would say that's not as bad as maybe what I was expecting. So the surgery took about twice as long as what they were originally expecting, and that's because when the surgeon got in there, he did find that there was a lot of scar tissue and previous damage from my gallbladder surgery. That was about 6 or 7 years ago. And I think of that as a very good thing, because who knows what kind of damage that stuff could do long term. But he said he had to get all of that stuff cleaned up before he could even do my normal surgery. But apparently I did get a really good compliment on my liver. I didn't get to hear this yet, but hopefully when I talk to the doctor before I'm discharged, he did say that my liver was very flexible and he made it really easy to do the remainder of the surgery. I've received a lot of texts and Facebook posts and calls of just people who just told me that they've been praying for me, and I've really felt that. I've really felt it at peace and calm the entire time. And there's nothing like being part of a community of people that really love each other. and I could feel that a lot, and it just makes this from feeling like something you're doing alone and by yourself to feeling like something that you know that others have your back and they're looking out for you. So now, probably in the next couple of hours, the doctor will come in and discharge me, and I'll be able to go home. And then there's about 2 weeks of recovery time, is what they've told me, in terms of getting back to being able to go back to work and stuff. So I guess I'll be looking forward to a lot of time of catching up on my TV watching, playing some video games, and then of course making videos.